Now then, what could hospitals look like after COVID-19, if there is ever an after, that is? There are calls today for changing the way we build hospitals. A project led by the think tank Policy Exchange, and it's been backed by the Health Secretary, Matt Hancock, looks to adapt the ways in which hospitals are designed to better fit a more modern patient, they say. Do away with a more traditional hospital format, which has been branded inefficient and impractical. Well, to explain all of this, Ben Southwood, Head of Housing, Transport and the Urban Space at the Policy Exchange think tank, joins me. Morning, Ben.
Good morning. How's it going?
I'm very good. What's wrong with hospitals and how could they be better?
Well, I think that it's about learning what we have done over the last 70 years. So the way we've built hospitals has been pretty constant for a long time. And it may have been that we should have shifted steadily over time. But this recent shock brings a lot of it to the fore. An example is if you've got everyone on big wards, then maybe when you have an extremely virulent disease like COVID coming in, you think, things we've learned about the value of individual rooms may be especially important now.
And so what is basically the rows of beds and, the nurse walking up and down between them? Is that what needs to change?
Well, I think that's one thing that definitely is going to be considered. It's not always going to be possible, but there are some hospitals built over the last 10 years where we've managed to go for almost exclusively private rooms, like in Royal Tunbridge Wells, Pembury Hospital did that. So it's clearly something that I think that the tendency does seem to be shifting towards that around the world, and COVID is only accelerating that. The project is hopefully not just looking at things that COVID brings to the fore, but also thinking, okay, we're doing this big investment, one of the biggest since the 60s in new hospitals.
Oh, well, but you're still there, Ben. The line's slightly dropped out there. I think we might have lost Ben. That was Ben Southwood from the Policy Exchange think tank. They've got a new report out today looking at... they've launched a call for evidence, I think, inviting clinicians, medical staff, patients, policymakers, economists, anyone with basically any ideas on how to improve the way that hospitals are built and managed. I think we've got Ben back. Are you back on the line, Ben?
Yeah, I'm sorry. I hope that wasn't my fault.
I'm sure. No, I will take full responsibility in keeping with the with today's political mood. I take all responsibility, and I'll blame someone else later.
I'm going to use that. I'm going to use that as an excuse to talk about my own shop element of this. So we have obviously a full health team working on this project, but I was brought in because one of the ways in which I think hospitals have been built wrongly over the last 50 years especially is in how they integrate with the urban space they're in, how people get to and from them, the transport elements, and also what they're like. And so I think what we did, one of the parts of this project is we did a big poll, and we looked at, among loads of other detailed things about healthcare and what people value in their room, like light and whether they get a private room and all those sorts of things. We also looked at which hospitals people actually like to look at. And I think that the aesthetics of buildings can sometimes be underrated. And so we got everyone to rate hospitals. We tried to pick as similar as possible pictures as we could of the 9 hospitals we picked, and picked something from every era of hospital building we could find. And there was a pretty consistent picture of what people preferred in terms of the hospitals they like to look at and the ones they didn't like to look at. So places like Sunderland General Hospital and Watford General Hospital, which are built in the 1960s and 70s, you might call them brutalist if you were being unfair on them. They got 3 out of 10 average across all the 1,000 people we asked. But if you look at Northampton General Hospital, which is beautiful Palladian with a nice sandstone, that got 7.2, actually less than I'd have expected, because I'd give it a 9 personally. But I think this is very interesting, and you can look up the full results on our website shortly. But I think that's the aesthetics of the outside is part of a broader thing of, should everyone drive there and back from a hospital? Should a hospital be situated in should there be some connection to the city? Should it be easy to get there and back? Obviously, the issue of hospital car parking, which comes up again and again, reflects this concern people have. And so I think that's another feature of what we should look at when we decide how to build these.
So is that one that you gave a 9? Is that your favourite? I don't think I've ever asked this one before. What's your favourite hospital?
Well, I think Northampton is probably one of the best in the country to look at. I looked at dozens when we were deciding which ones to put in the poll. We're trying to get a fair representation. So we got a mix of the older hospitals like Northampton. We got some of the and Leeds General. We didn't actually put in the end, but that's that kind of era, Victorian and prior. Then there's the mid-century, 1950s, 60s, 70s, and so on. And then you get the 90s and early 00s, and then you get some brand new ones. So Moorfields Eye Hospital has an extended, a brand new, kind of a very modern design, and I'd encourage you to look it up either on our poll or on the internet, because it's very interesting, this new building. And well, the people hate it, so this is a very awarded design.
Oh yeah.
Architects would probably tell you was incredibly beautiful, but it's quite shocking to look at, and well, the public didn't like it.
If you're feeling a bit sensitive on the way to hospital, being confronted by a shocking building is probably not what you're not what you're looking for anyway. Really good to speak to. That's Ben Southwood from the Policy Exchange think tank. They're doing this project on how to rethink what hospitals should look like. Possibly the first person I've ever come across who's got his own favourite hospital. But anyway, look those up online if you want.